marijuana is a medication, and we want to try to get that medication to patients as inexpensively as we can. So having a significant enough number of dispensaries that creates competition between the dispensaries, having them operate as a nonprofit, those types of market mechanisms drive down costs. And then the third thing was is that we wanted to have a system, if we were going to go with dispensaries, we wanted to make sure that we had a system that didn't have negative effects on the community more broadly. So that's where the reason why the initiative is so long is the majority of that language is the regulations on the dispensaries. And we want to make sure that these facilities are good neighbors, and we went out of our way to address the concerns that states like California and now recently Colorado have been experiencing with their dispensary models.
Okay, the marijuana that's going to start these has to come from somewhere. Whether it's the seeds from somewhere or the marijuana from somewhere. So somebody's going to have to go out and purchase this stuff illegally to get started. It's not like the government's going to give you some. So where's the marijuana going to come from to start these dispensaries?
It has never been a problem before in medical marijuana states.
So basically they're going to get it from your local dealer.
It's never been a problem before in medical marijuana states. I mean, we're dealing with, I mean, we are committed, no, it's not going to be from our local dealer, but we are committed to having a closed system in Arizona. And we have penalties that are very strong that are in place for diversion outside the program. And this goes into the third goal that we have, not trying to have a system that is going to have negative effects on the community more broadly. Any diversion of marijuana from within the system that is grown by a dispensary that is then distributed outside of the system to an individual who is not a patient within the program is a Class 2 felony under our law.
But you still haven't answered the question of where does the marijuana, assuming this thing passes in November, and let's say January 1st is going to be clinic, where are they getting their marijuana? It's not, you know, I mean, the marijuana fairy isn't going to come around and drop a little bit in each place.
Right.
Where's it coming from? I know, there's no problem anymore.
Don't they have to grow their own under the initiative?
They do. I mean,
I'm sorry, but where are the seeds coming? Come on, you know, it didn't happen by spontaneous combustion.
Right. I mean, and I think that the most, I mean, that is up to dispensaries to acquire their product in a legal manner. And I mean, I think that a lot of those facilities will probably acquire their initial material from states that already have medical marijuana programs or from other locations that already have a medical marijuana program.
But you can't do that under federal law. You cannot create medical marijuana.
We can't distribute marijuana under federal law. I mean, the thing is that I mean, the entire program is technically illegal under federal law. We have had the administration has stated, Howie, please. The administration has stated very clearly that they have no interest in prosecuting medical marijuana cases as long as the doctors, distributors, and patients are operating in accordance with their state law. And I think that that is the answer to your question.
So we're going to bring it into another state and violate interstate laws. But I still haven't heard where the seeds are coming from.
I mean, Howie, I can't. I mean, I'm not dictating where the raw materials come from. But I mean, I think that, you know, saying that we're going to bringing seeds across state lines violates federal law and makes it impossible. I mean, the entire program is technically in violation of federal law.
Andrew, what are the regulations for cultivation? Can you explain how that works, how they grow their marijuana? Like, is it at the facility or?
Right. Each marijuana dispensary is allowed the facility that they operate as a dispensary plus one additional facility to grow. So all product that is used within the program must be cultivated by Arizona-based dispensaries.
So can we assume the DHS may be growing it then?
I would assume not. I mean, I think that however, though, it will be state licensed facilities that are doing the growing. They'll be regulated by Department.
So what's changed to get this on the ballot today?
What's changed?
You said that Arizona has been demonstrating or people's will to get this passed. What's now changed that it might get passed in November?
Well, I mean, the reason why we haven't had it on the ballot again since it was on last time. I mean, there have been subsequent efforts, but the difference between those previous efforts and this one is that we drafted a complete law this time, and we were able to secure the funding to make sure that we were running the campaign in a proper way. I'll take one more question.
Conditions that permit people to cultivate their own program.
Sorry, what's that?
If you're a patient, you said that some can cultivate.
Yes, if you are a patient that lives more than 25 miles from the nearest dispensary, you can cultivate a limited number of plants for your golfers. And that, again, goes to patient access. I mean, if you're somebody who is a very vulnerable individual who's living several hours from the nearest marijuana dispensary, that can be prohibitively difficult for you to be able to acquire medication. So thank you very much.
Could I ask another question?
We can do afterwards. Okay. Yeah. Thanks, guys.
I know some folks have to leave for